causing, you know. Okay. Oh,
I thought I had it.
okay, so, and causing enhanced immune deficiency and so forth, so it's, and so I don't know why we're neglecting this, you know, so, the other thing too is, if you're injecting citizens with a substance and they're not really informed, is that even legal? It's not ethical, it's against all bioethics. And in many states, it's called battery or assault. If I give you a prescription, and I don't tell you what it is, or I spike your food with something, you know, and that person suffers some type of side effect or death, I'd be arrested and put in prison. And here we have all kinds of stuff going on with these vaccines, and we just turn our back on these people. So the other thing is, I mean, I would go so far, we're vaccinating so many kids right now, the statistics are not gonna lie. Eventually, one of them's gonna die. And when that happens, who's responsible? Does the kid know what happened? Do the parents, were they informed? I would call that negligent homicide under MCA 45-5104. So, and just another statistic I wanted to say, you know, the number needed to treat, right? The NNTD is what they call that. Nobody really knows what NNTD stands for, but it's a number needed to treat. So Pfizer had come out and submitted all kinds of, you know, documentation to the FDA and the CDC and NIH for approval, for emergency approval of this vaccine. Okay, and so part of that study, they needed a number needed to treat to contain the virus. So in conservative estimates, 5,248 children would have to be injected by the mRNA shots in order to save 45 children from dying of the coronavirus. For every one child saved by the shot, another 117 would have to be killed. That's insanity. Do we not know this? There's a, you know, I don't know if the health department doesn't know this. I know you're looking at me like I'm just pulling this stuff out of my rear end, but I'm not. So the CDC is covering up this data. They've contradicted themselves, like I said in the past. And I don't understand why you're stuck listening to them. I mean, I have the Hippocratic Oath in front of me, and of course, all the PhDs and medical doctors and stuff in the room, when they're licensed, they should, they actually have some version of this, they swear. And it has things in there like, I will apply for the benefit of the sick, all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism. So, and I'm not going to be ashamed to say, I know not, nor will I fail to call on my colleagues when the skills of another are needed for a patient's recovery. Above all, I must not play God. I remember that I do not treat a fever chart, a cancerous growth, but a sick human being, as we're all human beings in the eyes of our Creator. You know, so don't treat the disease, treat the human being. You're not supposed to do any harm. We're doing far more harm sociologically, psychologically, and economically than we can ever do good. So here's what I don't find in the Hippocratic Oath. I will do what the CDC tells me to no matter what. I will do what the CDC tells me to, even if it's against, you know, my own morals and everything else, or even against my own scientific studies. There's nothing in here about obeying the CDC nonstop, just, you know, no matter what. So I don't know where this comes from. I don't know why we even have a health department or individual physicians or an individual state health department or a county health department if we're just going to basically repeat what the CDC says. And I mentioned that last time I was in here that, you know, the CDC is corrupt. We've got a corrupt federal government. Right now, me standing here talking to you, you know what the Department of Justice calls me? A domestic terrorist. I'm a domestic terrorist because I believe in Jesus Christ. I'm a domestic terrorist because I believe in the Declaration of Independence, that I believe I have the right to, you pursue happiness and, you know, I have the right to life and so forth. And if that's what makes me a domestic terrorist, and I wear the badge proudly, I don't care what the consequences will be. I'm never going to renounce my faith. I'm never going to renounce my loyalty to the Declaration of Independence. I'm not going to renounce my country, even though my country has declared war on me. With all this said, I think it'd be ideal if the citizens have like a town hall meeting. Because I think the county commissioners, I mentioned this to you, Pam, and Ron Lee, I mentioned this to you. I said, I think it's failed the citizens. And if we can't stand up and address the citizens and their concerns, then I think it's time that Pam and the other commissioners resign. And you too, Ron Lee. These are serious times. It requires a serious response.
Okay. Anything else?
Is there a Deborah Wilson that's in here? Or a Kurt
Look.
McKenzie?
We'll get to the online here in just a minute. We're gonna do the individuals in the room first, so hold on, Kurt.
Sean Padina?
Hello, everybody. My name's Sean Pandina, and I thank you for letting me speak, even though you've changed your policy. I knew nothing about it. If anybody else wants to speak, you need to talk to her. I guess they're letting us in to speak today, and from now on, you have to register prior to the meeting to be able to speak, which is absurd. To me, I don't like the policy. I think you should change it. I think if I show up and want to say something, you should let me talk. And you are today, so I appreciate that. So in this country, if you are arrested and you know, they say you did something, you're innocent until proven guilty. However, if I go down a lot and I need a surgery at the hospital, they make me take a COVID test prior to having my surgery. So there's no less tyranny in that than saying I'm guilty until proven innocent, because basically you're saying I'm sick until proven healthy. Well, guess what? If I don't have symptoms, I shouldn't have to take a COVID test. I think y'all need to stop contact tracing. You're contact tracing in the schools, which leads to students losing more and more education because they get that little letter from the health department. It goes to the school, and if it's in the school policy, all of a sudden they're quarantined and they're losing more of their education. This is a serious problem. This is causing kids to kill themselves, which is a big problem here in this valley, in this county. And I think that part of the policy of this quarantining and stuff and keeping kids away and saying they're sick when they're perfectly healthy, and then they, you know, they're stuck at home. And sometimes if they're young enough, the parents have to come out of work. And what do we see? We see restaurants that can't even open because the parents are at home taking care of their kid who's perfectly healthy and quarantined. Or you see the kid at home unsupervised because they're open. Well, that's going to lead to terrible things. Unsupervised children, it's just probably not a good idea. You know, 12-year-old, oh, you know, they're old enough to be at home by themselves. Well, you know, what if they play with matches or something? You know, they can hurt themselves. That's a health concern. So I'd ask you to stop contact tracing. I'd ask you to stop. If you did that, then they'd stop quarantining, because they're only quarantining what you all say, what the health officer says, it has been a close contact. And then they won't even tell you. They won't tell you who or when or where. There's been a close contact, but they don't have to prove it. I've got these letters myself for my children, and it's not okay. This needs to stop. And children are so unlikely to die of COVID, it doesn't even register. It basically rounds up to 100% likely to survive. And to have these clinics, which I understand it's the parents' choice if they want to do that, and that's fine. But to put out information that it's safe and effective, and to not put out the real information that your child might end up paralyzed, myocarditis, they might have problems for the rest of their life, because this is an experimental shot. It's not like the other shots that came along in the past, which would use a dead vaccine to build immunity, and your own immune system would create the antibodies. This is making your body manufacture spike protein. How long is a body who manufactures spike protein going to be able to survive? There's been hundreds, over 100 soccer players dropping dead or having heart attacks on the field in the last 12 months. Please stop pushing vaccines. Fine, still have it available down here, but you don't need to have a special clinic and coerce people by giving out prizes for coming down for their kids, you know, like a little candy. Candy was given out. Promoting, come get your kid done, they get a little candy bag, good bag. Sure, kids want candy. Kids don't know that they might have serious complications as an adult, or might not even make it to adulthood. It's really sad. Thank you for your time.
Thank you. Anyone else wish to speak?
Next, I have Jake Kirby.
Hello, everybody. Yeah, Jake Kirby here. First of all, I'd like to know, why was the meeting changed to today instead of Thursday? Why was that? Can anybody answer that for me? Joe, can you answer that for me?
It was because a couple of our board members or something couldn't make it. I don't remember.
Our chair had
I can't hear you.
our chair had a conflict. Our board chair had a conflict,
Okay.
and he asked for the meeting to be moved.
What type of rules do we have, as far as when a meeting can be moved? There's gotta be some rules out there.
Normally during public comment, we can get you those answers, but normally during public comment, this is your time to give us information.
Okay, well,
So, but we would love to give you those Did you get his contact information?
I am sick and tired of all the garbage that's going on in our country right now. I'm sick and tired of our leaders, health board officials. I mean, you know what? It's time to stand up for our rights. You work for us here in Montana, correct? Are you taking outside money from federal government? What's going on? Push it to here in Montana? Freaking, this is a bunch of garbage. I'm sick and tired of it. It'll be a cold day in hell before my kids wear a mask. They're completely healthy. They really have no risk of getting this COVID. There is no freaking way that they're gonna take this clot shot garbage. It's not a vaccine. There's tons of kids dying from it. This is a bunch of garbage. I'm sick and tired of this garbage. I mean, really, anybody that's given their kids these vaccines, have they done any research? No, they don't really know what's going on. And obviously, we're not telling them the truth. This is just crazy. You know, we are all gonna answer to Heavenly Father one day. Every single one of us. I don't know if you guys believe in God or not, but you know what? We're a Christian nation. We were founded on a Christian nation. We will all answer. This is all gonna come around. And like Hannah and Sean said earlier, we're gonna see the effects for this forever. We also know the vaccines are people can't get pregnant, they're sterile. Is this really what we want? Population control? That's what's going on. And every one of you at this table need to stand up for what is right. I mean, every one of you. This is a bunch of freaking garbage. Herd immunity. We all know herd immunity works. Why wear a mask? I've had COVID. I'm okay with it. So what? I got through it. I don't want to see anybody die. I don't. But you know what? We all have our own brain. If you're sick, stay home. You know, there's a lot of different methods. And there's some really good treatments out there also. We don't need vaccines. You look what's going on in our country. Businesses going they're going out of business. Pilots are dying. This is screwing up our whole country. Please, freaking stand up for what is right. Thank you.
Thank you.
Next person is Dennis Thomas.
First of all, I'm a Navy veteran. I have gone to the clinic. I haven't gone to the clinic since all this COVID stuff came into play. When I went to my annuals nurse would always ask me, have you gotten a flu shot this year? I said, no, I will not get it. She said, don't get it. She emphasized that. She was telling me what's in those things. And what's in these vaccines that they have now, we don't know what's in them. They're 10 times worse than flu shots. And I have been sick in my life. I have had bronchial pneumonia, I've had bronchitis, and I got through it without taking prescription drugs. I used homeopathic remedies to cure myself. Can anybody in here tell me the meaning of pharmakia? Nobody. You got it, Andy. It's the Greek word that means magic, sorcery, witchcraft. So our word pharmaceutical comes from that word. So pharmaceuticals are poison. They do not help us with anything. Thank you.
Next one is Teresa Clark.
Have a few. Can you hear me? I have a few prepared remarks. I'm jotting down to help me stay focused. I encourage the health board members to follow Montana's non-discrimination policy HB 702, where discrimination of vaccinated status is illegal. This law was rightly put in place to protect the rights from overreach of government and entities that want to disregard our constitutional rights. In the COVID rush, mandates were put in place. Government and entities tried to force vaccination, usually through coercion, job loss, children attending school and such. But now more and more data is trickling in to show just how wrong the experts were and at a very low cost to many citizens. I personally feel in the rush with the vaccines, there wasn't enough time given to study the adverse effects. That is many people's concern. I just don't think there's been enough time, and I think so many things continue to change that it just proves that there wasn't enough evidence. We keep having, at first we were slow to spread, to if you get vaccinated, you'll be safe, to everyone who's not vaccinated, they're filling the hospitals, to now people that are vaccinated are carriers and are getting sick, and everything just constantly changes. So those things are being forced upon us, and they just don't feel right. Our day-to-day observance just doesn't coincide with the panic that we're constantly being told is true. I think that's when I started paying attention. I'm not an expert by any means, but I can read and I have common sense. And I know a lot of people, and almost in every case, it's like the flu or cold. I know 2 people that have gone to the hospital. They also have comorbidities. But very few people are really getting sick, and I'll come back to this, but that, I still cannot get over that we have no flu. Where has the flu gone? How did COVID come and now there's no flu? It's been reported in the paper at least twice that I've caught that there's no flu. What is the logic in that? How do we have no flu? And all of a sudden we have COVID, everyone has COVID, nobody has the flu. Not one case of the flu influenza in Montana. No children have died. Yet this panic, the excessiveness of the COVID cases acting like each case is a death, when for the most part, each case is someone's home with the flu. A lot of people don't even know. The forced testing is raising, many people are going to the hospital. Anthony Fauci, in an interview just 2 weeks ago, stated that about 40% of the children going to the hospital were children not going to the hospital because of COVID, but had COVID after they were tested and they were there for some other reason. The CDC director, I saw her on an interview last week, saying she said 75% of the people 65 and older had 4 comorbidities. And I'm wondering if we're taking these stats into consideration with the Flathead County statistics. I've been watching them for the past year because I was just curious to watch how they raised it. Once they took the mandate away, the mask mandate, and everyone was so concerned about super spreaders, I constantly would look at that at least twice a week. Masks were gone. I think Big Fork School was one of the first ones to say no more masks. Theaters were open. I attended many of these events, and it just never raised. It seems like it's just like the flu, it goes up, it goes down. Then with the Delta variant, it came up again, and now it's gone down. Now with this new variant that they say is a lot more contagious, but hospitalizations are way down. Unfortunately, there's been, the last update on the COVID tracker was over 2 weeks ago. And at that point, they had 88 positive, 8 residents and 8 non-residents were hospitalized. We're still at 44% vaccination rate. And our death rate is at 228. But I would love to know, and maybe the information's out there, and I don't know where to look. Out of the 228, if we're talking that 40% or maybe 75% are comorbidities, that knocks that number so low. And all the money and people losing their job. And what's going on to the children wearing masks and trying to learn how to read with a mask on? Can you imagine what's going on with these children? It's ridiculous. What I would like to hopefully see that updated. I would love to see real numbers. I would love to see what the age of the deaths are. These numbers are just out there and they mean nothing. What is the age of the people dying? How many comorbidities do they have? What are the real numbers? How many are really in the hospital? And they said hospitals are overloaded, there were a nurse and also a person who cleans the hospital. But in some cases and articles I've read, it's because of other reasons, shortages of staff. And I just don't know what the answers are, but I don't believe the hype, or I would know somebody. I read about people, I read a lot, I read every day, and the studies I read will have the links where I can see the study. So it's not just, because I know there's so much information out there, it's hard to read through what's accurate. But if you can go to a study and read it. And so that is the one thing I would like to see. I would love to see or know where to find more information. I would love to see what the real, true death rate is for our county. How many of those numbers, what age? I'd love to see it broken out. Without the numbers, without the real numbers, there's just no way to know. There's no way to really make a true assessment. But the true assessment I see is it's way overblown. And I don't mean this as an insult to any of you here. I honestly don't. But about a year ago, I came to a meeting and you had your financial person here giving an update. And in no disrespect to him, but he said because of the COVID, we were in good shape. I really want to know, with the people going to the hospital, if they're not there because of COVID, does that get counted as COVID and did we get money because of that?
Yes.
I think a lot of it, I think if the money went away, the incentive of the money went away, this would go away awfully quick. Because the 1% of us that are really dying from this is ridiculous, and what it's doing to the communities, what it's doing to families, what it's doing is to businesses, lack of building supply, lack of steel. I know that schools are getting a ton of money, but at what cost? I went to a school board meeting and they had their finance there and I thought, good grief with the education expensive. I started homeschooling 15 years ago. My 3 older children went to public school. I have so much respect for teachers. I used to be a teacher's helper and I thought, we could get twice as much done in half the time. It's turned into a racket. We can get twice as much, more than twice as much done in half the time. We've turned everything into a game, a financial game, and there's winners and losers. And I appreciate your work and your efforts, but please, I'll reach out to some of you by email. If I could find a place where I could really read stats. Hopefully they're being kept, I assume they are. We need to deal with real numbers, not just what everything says it needs to be broken down. Thank you.
Thank you.
Next one is Dane Clark.
Greetings and salutations, to everybody, friends, neighbors, countrymen, hardworking people of Flathead County. I know we're all got a mortgage, we've got bills to pay. We're just common folks. We're not the Hydro Castle people that got all their bills covered. They don't worry about money. They like to play with social engineering. Those type of people are pulling the strings and calling the shots, and a lot of folks are falling in line and following these people. And we're not those people. So I'm a student of history, and looking back on history, if you don't learn from it, you're doomed to repeat it. And in one of the most popular interviews to come out here historically, it was Joe Rogan and Dr. Malone. And the one thing I got out of that 3-hour interview was the term mass formation psychosis. And I don't know if there's any psychologists here, but apparently what was told about this term is that it's been used over history to control populations. And it was used in Nazi Germany, and people always wonder, oh, why were the good people in Germany, Austria, and surrounding countries and whatnot, how could they do these atrocities to other people? Well, mass formation psychosis, write that term down, look it up. It's basically telling you about groupthink or hive mind, or just doing things to go along to get along, because that's what makes you feel good, like you're being being a good part of society. Anyways, that's something for, if there's any psychologists in the building, or you got someone you can go to, have them see if they can define that for you. If not, we'll get a lecture where there's a psychologist that can brief you on that, because that's what's going on here. I know all of our lives have been interrupted. My interruption ended up being good, because I was in Alaska 2 years ago, and we decided to make the call to move back to Montana to be closer to family that needed care. We didn't know if we'd be able to make it. We came across the Eureka border crossing a week to the day before they closed the border. Now it's only opened up to vaccinated people. And it was essential people were allowed to cross the border. Now they got to be, truck drivers now have to be vaccinated. Well, you're going to be having truckers not working. The calls for the hospital system employees, all the nurses and doctors and staff, need to be vaccinated. You're going to be seeing people leaving in droves from the hospitals, just like the airline pilots refuse to be vaccinated. They're just sitting there doing nothing, twiddling their thumbs, but they're at home with their families having a good time. All of our lives have been interrupted. It's been 2 years almost. I'm looking for a happy new year. I'm hoping for the best. I'm planning for the worst. I know you're consider yourself the Department of Health. I consider you the Department of Eugenics. That's another term you need to write down and look up. And if you don't need to believe me on that, but there's written history about people that were proud to be eugenicists, population reduction, get rid of people with epilepsy, islanders, people of color, whatever. They're using these tactics on everybody now. We're just common folks. We're fodder to be thrown into the volcano to appease their God, and their God is Satan. But we're hoping for this department to return back to being the Department of Health and Well-being. You have my vote of support. For those of you that continue to go on the wrong side of history, I don't know what to say about that. That's your decision, but I'm encouraging you to turn things around and do what's right. And you have my support. You have the support of these people. You have all the support about these people in the community that don't come down to these things. I just happen to be here, and I figured I'd show up because a lot of my friends are here and over here, and it needs to be said. And if you want to hear about adverse reactions, I'll invite my wife to come down here. She's a medical coder for hospital system, which had to switch her job around and actually resign from her last job because they're forcing the vaccine on her. And she works remotely. She doesn't even, this is in Washington, she works for a hospital system, and she works out of Montana. And they're telling her she needs to have this bioweapon, which is what actually is, and telling her she needs to have this vaccine and able to keep her job. Well, it turned into a hostile work environment after she sent it. I think it was a 17-page letter why she's not taking the vaccine. And turned into a hostile work environment. It took her a half a day to figure out she couldn't work for that company anymore. So now she's down in the hospital system in New Mexico. And I'll have to bring her down here to brief you on what she's seen every single day with adverse reactions all over her charts. And there's a cover up going on because they make certain to put unvaccinated on a chart. Like that's a big problem. They're not vaccinated. But when it comes to people and their adverse reactions, somehow they forget to put vaccinated with this COVID bioweapon on the chart. And there's a lot of data out there proving what's going on. There's some people that are outspoken about it, and there's some people that are afraid about their jobs, losing their job. Lose your job, can't pay your mortgage, can't pay your bills. So I guess money's calling the shots for a lot of these people, and that's not right. They need to do a little rechecking in there upstairs. Anyways, thanks for hearing me out. I appreciate it. Thanks for your time. Have a good rest of the day, and maybe I'll see you later.
Thank you.
The last one in here would be Diana.
Hello, good afternoon. My name is Diana Southard. I'm a new citizen here of Montana. I moved here from Illinois 3 months ago. I have been working in the healthcare industry for over 30 years as a diagnostic imaging technologist. I am licensed to take X-ray and CT scan here in the state of Montana and in the state of Illinois. I come from a medical background, which is pretty intense. I have worked in the Chicago City Hospitals. I've worked in Cook County Jail. I have run the gamut from the south side of Chicago to the richest and most beautiful places in Naperville, Illinois. But I come here today to let you know that the way that things are going is just a complete and total fraud. When COVID started, we were informed, on a Tuesday, that starting on Friday, we would have to start wearing masks full time. Well, if it was so deadly, why would we wait 4 days? It was my question, never answered. The next thing was that we were then told that we were to reuse masks, including the N95. An N95 mask, which is to take out particulate, is fit tested every year where we have to put on a special hood. They spray this chemical into it, and if we can taste it, then our mask is not fitted properly or being used properly. So using these masks in an environment by laymen is just ridiculous, gives you a false sense of security. In my years in X-ray, I have been coughed directly into the face by people that turned out to have active tuberculosis. Diseases of all kinds. I've been poked and spit on and bled on and all the other body fluids. And never, not one time have I ever gotten sick. And we stress that there's a concern for everybody's health and everybody else's health. And yet, no one's talking about prevention. No one's talking about any of the things that we need to take care of our health. Not to say that our government should say, you must go out and run 3 miles a day and you got to eat more broccoli. We're not going to go and do that. But what has ultimately happened is this giant oligarchy that has come down from the CDC, which is a company listed, by the way, on Dun and Bradstreet. It's a corporation that says that there are 65,939 companies in the Centers for Disease Control and Prevention. It's a corporate family. And not only that, but they own patents on germs and diseases and vaccines. So now we're going to be doing the dictates of the CDC, which seems like a big company is now going to tell everybody else what they're going to do. And that to me just sounds absolutely ridiculous. What happens is now they play with the numbers, and if you've had your vaccine and it's been 13 days since you had your COVID vaccine, you're still considered unvaccinated. So if you are not considered an unvaccinated person and you drop dead on day 13 after your vaccine, you are considered unvaccinated, which then you get pulled into this pool of lies that just gets bigger and bigger and bigger. And throughout history, there have been men that, and I can't think of what his name is offhand, but he was the propaganda, Joseph Goebbels, who said, oh, all you gotta do is tell a lie and make it bigger and bigger, and then people repeat it often enough and people will believe it. And that's what has happened. We've all been dumbed down by this fear, and like the previous speaker spoke of, it's a fear. And you know what, and Winston Churchill said, there is nothing to fear but fear itself. And we are gonna go around and instilling fear. And what has become of all of this is people are being discriminated against. And now you're not gonna go into a store because you're not doing this. Well, this is what they did in Nazi Germany. They told them that you ask anyone, any survivor that has been in these concentration camps, and they will tell you, they said that we were a diseased people. And this is what is happening, and people are being discriminated against and bullied in stores and knocked down. And I just want to let all those that act on the behalf of the state, that dress in police uniforms, or whether they be health officers or whatever it is, you are making war with a peaceful people who want nothing but resolution. We want a peaceful solution. But what has happened now in countries such as Kazakhstan and other places, the people have revolted and there has been death. And this is not what we wanted to come to. We want to settle everything peacefully. Now, I understand that, that there has been some issues also as far as the discrimination that has been going on here. And it is my understanding that on January 3rd, there was a letter that was sent out with the letterhead of the Flathead City Council Health Department, meaning this department. And this looks like it was an updated COVID isolation and quarantine guidance. And I don't remember there being anything updated. And to me, this looks like this was sent out by Mr. Joe Russell. And it is my understanding that, sir, that you act in accordance to all of the guidelines that are set forth by this board and are not to be acting independently and setting rules and policies and guidelines and whatever, and discriminating against children in a school. Now, to me, that resembles anarchy, because anarchists don't listen to those that are above them and think that they are a law unto themselves. And we cannot tolerate that. We are a country of laws. We are a people of laws. We want peace. We want the laws followed. We want to be able to stay within the guidelines as everyone else should. We can't all just walk around as rogue people doing our own thing. We are a community. I moved here for the sole purpose of not always being the sole person that was being unmasked. This is a baloney. I have been around, they said thousands of patients that I have x-rayed personally, been in their face. You can't stay 6 feet away from someone when you take their x-ray, you are in their face. And you know what, the way that we are handling things is just cannot be tolerated. So if we, in fact, do have a county health officer who I did see, in a picture of in an article once before, and I had made comment to it to the commissioners regarding that. You know what, we cannot go on in a state of panic and fear, being driven by a bunch of rogue and anarchist people that we look up to for guidance. And as this health board, which I kind of think is actually kind of unconstitutional, to tell you the truth as well, because I don't see any provision for it. I don't see any provision for any of these departments. Our legislature and all these people who are supposed to be, there's 18 jobs that they are to do. They're not to delegate positions to little agencies, 3-letter agencies, and all these. They've made it too big to control. It's a monster. And here in our community, I really have this faith in God that if we would all just come together, go by the rules, and just like calm down and quit acting like a bunch of Chicken Little, the sky is falling, crazy people, we could put an end to this. We could put an end to this today if we would just say, no, we're not going to discriminate against our children. No, you are not going to have to wear a mask. If you want to wear a mask, fine. If you want to get a vaccine or experimental jab or whatever you want to call it, fine. The one that the FDA approved is not even available here in the United States community. And that is not even available here, and they are giving this medicine to people with the idea that somehow it's been FDA approved, and it's only been authorized for emergency use only. We are not the lab rats. The government does not own me. They are not gonna tell me what I'm gonna do and what I am not gonna do. In 1979, when the Shah Ayatollah took over the country of Iran, the women were forced to wear a hijab and a burqa. From the day before, millions of women who dressed just like me, who also wore mini skirts and dressed like us, were told, starting tomorrow, if you don't wear this, you will go to jail, and it's 30 years after your beating. So we will not tolerate being pushed down as if we are some herd and gonna have herd immunity. We are not cattle. We are independent people. God put us here for a time such as this, and if we don't stand together, we are all gonna hang separate. Thank you.
Did we have some online?
Yes. Deborah Wilson, are you online?
I am.
Okay, Deborah, go ahead.
Okay, Board of Health members and audience, anyone who's there. I'd like to talk about the updated COVID-19 isolation and quarantine guidance that was dated January the 3rd from Joe Russell to all the schools, and that it violates the state law MCA 49-2-312. State law was violated by unilaterally setting and implementing isolation and guarantee guidance for the public school children without the approval of the Board of Health. The guidance segregates and discriminates against unvaccinated children. The guidance also must be rescinded and changed to conform to state anti-discrimination laws. Does Joe Russell really expect the general public to comply with and respect this guidance when they are the result of unlawful actions? The Board of Health is comprised of many members for a reason, and Joe Russell does not have the authority to change this policy on his own without the approval of the entire board. Please rescind the guidance, and remember, people are responsible for their own health. The people of Montana do not deserve to be treated like mindless boobs. Let the general public make their own health decisions. Thank you.
Thank you. Thank you. Okay.
Next one is Kurt McKenzie.
Okay, Kurt?
Kirk, if you're on there, can you please unmute yourself? The next one is Jessica Kirkendall.
Okay, Jessica?
Hello, my name is Jessica Kirkendall. I've heard from many of our local healthy families groups across the valley, as well as healthcare professionals against the mandate. And I have 4 brief points to mention. The meeting shift today was pretty inconvenient, and I wanted to mention that the midday meeting time makes it so that most working professional citizens can't attend the meeting. So that's one point I wanted to bring up. The next point, the new quarantine protocols that the school children have thrust upon them as of last week. The isolation and quarantine of school children has been significantly altered once again based on vaccination status without health board vote, approval, or review. Montana's non-discrimination law, HB 702, Montana Code annotated 49-2-312, prohibits discrimination based on vaccination status. In addition, per state law, MCA, Montana Code annotated 50-118D, the health officer is only allowed to establish and maintain quarantine and isolation measures as adopted by the local health board. The new child quarantine protocol includes a table violating Montana law that outlines the unvaccinated combined with any child who has completed the Pfizer Moderna full series 6 months ago and is not boosted, or completed a J&J 2 months ago and it is not boosted, all together in one group. So the segregatory grouping of the unvaccinated now includes children who were coerced last summer as unvaccinated. As a practical matter, where the triple boosted vaccinated are being coerced and the protocol has been released, several of those are rural K through 8 schools, and most of those schools are ages 5 through 14. The extra vaccine doses are not even authorized to be used on anyone over age 11. And so that brings me to my next point. The child vaccine is only EUA approved. Informed consent, I've been bringing this up for many months, so I'm sure you're aware. Informed consent is required for EUA product, is not happening in it is not happening in Flathead County, with a form that states no vaccine information sheet is available until full product licensure. I encourage our local officials to investigate the process and forms, as there is a vaccine clinic on the 12 to 18-year-olds still occurring all day, every Tuesday at the fairgrounds. And if you walk through the process, you'll find that informed consent and full information about the side effects is not being offered. Next point I wanted to make, Israeli vaccine study is finding that people with the latest variation, with the Omicron, after 3 or 4 doses, they're finding little difference in if the person gets sick or not. In fact, our local tribal data is showing that the majority of the vaccinated are getting sick. They post weekly updates as far as the vaccinated versus unvaccinated on the tribal areas around our area. Lab studies have currently found that the Omicron variant is very adept at dodging antibodies, which has been able to block previous variants of the coronavirus. The risk of COVID vaccine-induced myocarditis, which can be fatal in young men, is now estimated at somewhere between 1 in 2,000 and 1 in 3,000. 0 children and teens in Montana have died of COVID prior to the vaccine. Where there's a risk, there must be informed, non-coerced consent with all relevant side effect information provided to all parents. And the fourth and final point I wanted to make today is regarding the personnel committees that are being formed today. I looked over those committees and I would encourage the board to resolve all of these issues by taking action on these violations of Montana law and bringing up future major protocol changes and personnel issues and hiring as a public vote on the board. So discussion and decision-making has full public transparency. When I'm looking at the committees, I'm seeing most every member is heading a committee and placed on 3 committees, where an actual credentialed doctor, Dr. Bukacek, is listed as a member in 1 minor committee total. It's time to do what is right. Please use common sense to keep our county moving forward, following the real data and promoting real health measures without coercion and quarantines on healthy, thriving children. I appreciate your service and thank you for your time.
Thank you. Anyone else?
The last one is Thomas Miller.
Okay, Thomas?
Thomas? That's the last.
Okay, all right. Well, thank everyone for their comments. If you have written comments that you'd like to submit to the clerk, so that we can get like a written down sheet of paper like Ken has there. If you'd like to submit that to the clerk, we can put it on the record.
I
Or
can
anyone
email
else
it to
that has
you.
something, we can put it on the record, whatever you're comfortable
I'll
with.
email it to you because this is just notes.
Okay, all right. So we're gonna move on to approval of minutes for December 16th, 2021. And hopefully everyone's had time to read them.
I'll make a motion to approve the minutes for the December 16th, 2021 meeting. I'll make a second. Yeah.
Okay, any discussion? Seeing none, all in favor?
Aye.
Motion. the commissioners' chambers. We do it by name. Go ahead, Janelle.
Artist?
Just 1 second. If any of you, like I said earlier, I don't know if you heard it, but Health Officer Russell will be discussing some of the comments that were made today, and he's on at the last here, his health officer's report, which will come up a little later in the meeting. If you may want to hang around and listen to that, or you can listen online, whatever you'd like to do. So just making sure everybody knew that, okay? All right. We have, Janelle's gonna do the roll call.
Okay. Artist?
Yes.
Annie?
Yes.
Rod?
Yes.
Jessica?
Yes.
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 Ronald?
Yes.
Okay. So minutes have been approved. We'll move on to the election of officers. We have board chair, I believe, first. So what's the board's pleasure?
So I'd like to nominate Roger Noble to be the chair for another term. I'll second that.
Motion and second, any discussion?
And he's done a great job, and it's good for the continuity as we have new board members come on to have that continuity in the leadership on that position.
All right. anything
I
else?
really appreciate that he's very, very respectful to the citizens that come in to make comments, so
Okay.
it's very highly rated.
Anything else? Yeah, I think Roger has done a good job. With that, roll call, please.
Artist?
Yes.
Annie?
Yes,
Rod?
Yes.
Jessica?
Yes.
Dawn?
Yes.
Pam?
Yes.
Pete?
Yes.
Ronald?
Yes.
Okay. So now we have the election of the vice chair. What's the board's pleasure?
I make the recommendation to elect Pam Holmquist for vice chair.
I'll second that.
Any discussion? Okay, let's take a roll call.
Artist?
Yes?
Annie?
No?
Jessica?
Yes.
And Rod?
Yes.
Dawn?
Yes.
Pete?
Yes.
And Ronald?
Yes.
Okay. So motion passes. So we have Roger as chair and he is vice chair for the coming year. Next one is committee appointments. We should have all received those in the emails. There we go. So I know, Joe, help me with this. I know that we, the chair does most of these appointments, or you discuss it, I guess. The only one that I think we need to vote on actually is the solid waste board. Is that correct? Is that correct? Okay. Okay, so
I'll make a motion that the Flathead City County Board of Health make a recommendation to the Flathead County Commissioners to appoint Roger Noble for the solid waste board position. I second that.
okay. We have a motion and a second. Yes.
Is he willing to do that?
Yes.
She wants that.
He's not here.
That's
I spoke to him this afternoon.
I know he talks about his involvement.
It's very appropriate. I didn't get there for it.
Okay, with that, we have our new appointments, and including the solid waste board.
Do we need to make a vote?
Janelle.
Artist?
Thank you.
Yes.
Annie?
Yes.
Rod?
Yes.
Jessica?
Yes.
Dawn?
Yes.
Pam?
Yes.
Pete?
Yes.
Ronald?
Yes.
on to departmental reports. First one is the animal shelter. Hi, Cliff.
Afternoon, members of the board. I'll try to be brief. Little good news, bad news scenario from the shelter. Looking back over the last year, there's our annual report that compares us to 10 other shelters in Montana that use our same software, and about 1,500 in the country. And the regrettable thing for the staff at the shelter is we had a little higher incidence of canine euthanasia this last year. Highest that we've had in about 10 years. And I think there's a couple of reasons for that. We're going to work on that, but we did have an increase in dogs that were in for bite quarantine, and one of the options that the owners of dogs who have bitten someone and aren't vaccinated for rabies, their choices are to have their dog quarantined at the shelter for 10 days. They sometimes can qualify for an in-home quarantine, or they can have their dog euthanized by the shelter, which is less than the price of quarantine. And we had an uptick in that this year. We also had an increase in court-ordered euthanasia of vicious dogs. And but probably the biggest thing is the housing market is causing a lot of people to move into housing rental housing that doesn't allow pets. And I think some of those people are hardworking people. They're not home a lot. It seems like a high percentage of those dogs are have behavioral issues and socialization issues. And they're dogs that oftentimes we just can't risk the public's health and adopt them out. So unfortunately, we have a policy. We get together with our veterinarian, myself, and whoever is in charge of dog handling, make those tough decisions. So this year, I'm personally going to get more involved with housing and landlords. We have a program. We have the ability to help people improve their yards and that sort of thing. And so we didn't have a lot of takers this last year. I'm going to see if I can be more proactive and work on that. And I think we can get that number back down. The good news is our cat euthanasia wasn't higher than it has been for the last 10-year average or so. And so both of those are way below the national average, but we pride ourselves on getting animals out fast and alive. And we do have, you can look up there on that chart, the very bottom line there says average length of stay, where last year we averaged 6 days for dogs and 14 days for cats. That was lower than the rest of the state and the country, so we're on the right track there. We're going to keep trying to do that. So we have that to be proud of. And the other bit of really good news is Joe and I went before the county commissioners and asked for a budget amendment to increase our, update our radiology system. And we were looking in this last year, our x-ray equipment was about 7 or 8 years old when we bought it 6 years ago. And it's out of date. Parts and service are not so readily available. And it just so happens that there's a veterinarian in the valley now who's also a radiologist and happens to be sitting on this board. And she came over and worked with Dr. Gordon and myself, and we looked at 3 different systems. And with Dr. Jessica's help, the system we picked was not only the most desirable, but it was the low bid. So that's good news. Thank you, Pam, and the commissioners for that. And let's see. I guess the other 2 items of interest, I'm sorry, Kirk's not here, but this last year we put an icon on the website for people wanted to know how they could donate. a little easier. And yesterday was Betty White's 100th birthday, and we had 41 donations. And so I finally finished writing thank you notes today, so that was a nice bit of news too, so. And one last thing, just a news item, there has been an increased incidence of heartworms in dogs in the valley for various reasons. We've not been testing, and we've made the decision that we need to start testing for heartworms. It's not, the testing itself is not terribly expensive. We're gonna take that on. The treatment of positive dogs is, can be fairly high, but I'm confident that we'll have less than 10 that we'll have to treat in the numbers that we'll be testing. And so, but we're always trying to be on the forefront of animal health because we're such a large receptacle of dogs and cats. And so we think it's time to be responsible for that. So that's something new for this year. Any questions?
Thanks.
Yes.
Thank you for your amazing work. So for the dogs that were euthanized as aggressive possible rabies cases, were they submitted for collection, like their heads to test for rabies? after
The
euthanasia?
ones that had bitten,
So
yes.
they were, I'm guessing they were all negative then.
Yes, and yeah, we had no positives there.
Thank you.
Anything else?
Thank you.
Okay, thanks, Chris. Okay, we're gonna go on to environmental health. Okay,
Hi, how you doing? Good afternoon. I'm Kate Cassidy, I'm the Environmental Health Department. I know some of you new faces here, so welcome. First of all, I just want to go over our 12-month running total. I think we've got that one up there. End of the year inspections, we did over 1,500. That's just in the food program. So I broke that down into our small retail foods. We have 351 licensed small food retail establishments. Those include your mobile units that are out there that operate at events. Sometimes we look at those several times during different events. Large retail, so those would be your larger restaurants. We have 482 licensed large restaurants out there that we look at. And let me tell you, these larger ones, we look at them twice, 3 or 4 times a year, depending on if they're out of compliance, we go back. So that's why you'll see that number of inspections are quite high at 1,569. We did have quite a bit of increase in this last year because of the non-compliance with some of these restaurants. And a lot of that had to do with lack of employees, we found. They weren't trained. So turnover, and we're going to do an inspection and finding out these people were not trained. So just going back more. And then on the next page here, keep going. I wanted to show you our graph or end of the year graph that we do on our septic permits and applications. It's the colored red, there you go. So as you're all aware of how this valley has been growing and the construction, how many applications we took in for the land program, close to 1,000. Quite a bit increase from the previous year, about almost 250. So we're scrambling in that program. I don't really have much else to talk about. So if there's any questions on our program. Art, you have anything?
I do.
Okay.
So on your guys' plan reviews,
Yes,
does that consist of vacation rentals and
yes.
is that what it is?
Mostly vacation rentals. And I think I talked a couple months ago on that, where those plan reviews are. Vacation rentals, they take up a lot of our time. More so if they're on a septic system, because then we have to go looking for that permit. You're well aware of that process.
And then last month you had Crystal here. So did she pass her
She did.
test?
Yes, we got a
Okay.
new sanitarian, so as of last month, so we've got 2 fairly new people.
Fred, he was in August, he passed, so he's trained up and been doing a lot of site evaluations. And then Crystal, we're training her with the site valves, doing test holes, and I'm looking at soils profile, and, yeah, they're gonna be some good youngsters coming on.
And then she'll get them to look at DEQs.
Eventually.
And artist, I have
Small
had
steps.
some communications with
Okay.
a few about
Perfect.
Crystal and Fred starting some training.
Okay, great. So, okay, thanks.
Anything else? Anybody have questions on the program?
Thank you.
All right,
Thank
thanks. All right, next item is community health.
So, and Keelani is at their house.
Okay.
And we're really short staffed there, so she asked if she could stay there and help.
Right.
I'll make sure she presents this.
Thank you. So population health.
Jen, she can come up. She's been monitoring the
We're kind of around the stairs. Hi, I'm Jenna Koski. If I haven't met the new board members, so welcome. I'm with Population Health. So December was pretty slow as far as our population health programs. Obviously, it wasn't slow for the chlamydia. They went up to 30 cases. So that was a pretty busy month for that. But everything else, there was a lot of vacations and people taking time off for the holidays. So all that was kind of slow. But if you guys have any questions about any of that?
Any questions?
No?
All right.
Okay, that's fine. Thanks. I'll run back.
Thank you.
All right, next one is mosquito.
yeah, Jake is-
Oh, there you are. Hi, Jake.
Good afternoon. My name is Jake Grubel. Those of you who haven't met yet, the Flathead County Mosquito Control District. So yeah, last year, just for a little bit of background, was a fairly typical year for us as far as mosquito control goes. Conditions obviously were drier than normal, but with the rain hitting seemingly all at once in June, we ended up with a fairly busy early season that made it pretty typical there. The totals are there in the report. So we did 7,321 site inspections, applied 969 larvicide treatments over an area of 1,303.92 acres. And we also applied 9 adulticide treatments covering 216.4 acres. As far as West Nile virus goes, it was a very light year for Montana. Only 7 positive pools detected, none of them were in Flathead County. So we had a very nice year there. We like to see that. As part of our National Pollutant Discharge Elimination System permit, monitored by Department of Environmental Quality, we do have to have our pesticide discharge management plan reviewed by the Board of Health every year. I apologize with the quick turnaround for the meeting. I wasn't able to get that in time, so I will submit it again next month for review. It just has to be reviewed in 2022 to stay compliant, so we have plenty of time to work with there. In other news, I guess our district sold 2 of our amphibious ATVs that were encountering pretty severe mechanical issues on a pretty constant basis. And with money from that, we were able to return some of that to SIP, and the commissioners approved the purchase of another side-by-side UTV. We are working through the purchasing process on that, but you know, things being the way they are, we're looking at several months before we will be able to take possession of that ATV. Commissioners also approved the SIP amendment to purchase another truck for our program, which I just heard from Corey has actually arrived today. So we're ahead of schedule on that from where we thought we would be. And we are preparing for our field season, which will begin again in March. So we are working through job announcements, trying to finalize details on that to hopefully hire seasonal staff and dive into the next season. Don't have any questions.
Any questions?
All right, well, thank you very much.
Thank you.
All right, finance.
Hello. Good afternoon. My name is Kurt Zander. I do the accounting for the new members here at the board. I handle budgeting, grant reporting, and just general accounting overall. Excuse me.
Andy, I think you sent in some questions that we might as well just answer those right away here. That, and I think the board members got an email concerning that, so there, to answer your question one there, the difference, the reason those aren't reported together is that those grants have different fiscal years, as you alluded to. So what happens is that you can't combine those together, and the general fund has always been reported separately, it's just the most important. So those, it's not combined, those graphs at the very end of the report are just for the grants. So does that answer your question?
To some extent,
Yeah.
but it would be nice to have that lined out, because there's no way we can analyze this the way it is, in my opinion. You know, and I've owned my own business for decades, and I'm good at statistics and budgets and those kind of things. And I know there's a way that this can be lined out that can be understandable.
Sure, and maybe the finance committee could talk about that, or, you know, that might be the case, but
But primarily it's because of the grants, different fiscal year.
also too, there's grants, there are some grants that cross fiscal years, and there are some grants that start in the middle of the fiscal year. Our fiscal year, the county's fiscal year ends June 30th. But you were talking, like in your question two here, that some of the grants had not been spent down, but some of the grants really started October 1st. So if you're looking at WIC or parents as teachers, those are just getting started for their fiscal year. So their percentages of what they've spent in the budget would be lower at this point. And so as time goes on, of course, you'll see those increase. But there's also another reason too, that grants are done on a couple different, contracts are done on a couple different ways. One is a reimbursement basis. So that means we get reimbursed for the expenses that we spent first. So we have to spend the expenses or the expenses out there, expenditures, and then we apply for a reimbursement and get paid for those. And so even though the budget may be, let's say for, you know, $200,000, if at the end of the day, we only spend $179,000, that's all we're gonna get for revenue. We're not gonna get those extra dollars because we're only reimbursed for our actual expenses. And then the other grants would be deliverables. And as long as we meet the deliverables, then we would get paid. But if we don't meet those deliverables, we don't get paid. So,
Okay. And then at the end of the year, do we have information of what was left over and has to be given back because we didn't use it?
yeah, there, at the end of the day, we can go through and we can see, you know, most grants are just spent. Because again, you know, if they're reimbursable, there is nothing left over. So,
You said we don't use it.
pardon,
You have to use it. You have to use the whole thing.
when you're, even though you're budgeted for 200,000, yeah, if we only spend 179,000, let's say, for example, on a reimbursement grant, that's all the money we're gonna get. So if we spend 179, collected 179, there's nothing.
Oh, okay, I get you. Okay.
Does
So
that
it
make
would be
sense?
useful on those pie graphs if it said the start of the grant. That would be,
Yeah.
that would have been helpful.
And yes, I can certainly add those.
Okay.
Yeah, that's not a problem. And
Okay.
there are some of them, like I say, that even on some of the smaller ones, we've got extensions. So even though the ending date was, let's say, September 30th, we may have got an extension that extended it another 6 months or maybe a year, just depends on the type of grant too. So, and I think you got the detail there for number 3 with all the different grants that emergency preparedness, tobacco, cancer.
I'd still love to see a breakdown of how it was spent. You know, one of the concerns, like when the community members, I think more than one brought up as far as the, you know, the contact tracing. And it is part of the reason why we're still doing it, because we were given money and we have to use it. You know, those kind of things I'm curious about, and there's no breakdown. So for those things that are specifically medical or something that I would be, which I gave you the list of the ones that I'd be most concerned, I'd like to see, you know, the breakdown and how it was spent and
That
how.
would be in the detail that I sent. So you can look and just review through the detail and,
Oh, so you sent it to me.
pardon me?
Okay, super.
Yeah, you should have.
Oh,
to
thank
already.
you.
So, yeah, if you look through the detail, you can see,
Thank you.
you know, what all that is. Most grants that we have are personnel. So, you know, it's personnel that runs this and, you know, very small in the way of operating expenses, but it depends on the grant.
Okay.
So,
So if I have more questions after I look at it.
absolutely.
Okay.
Yeah, absolutely. Anyone else have any questions on that?
Well, I'll just like to make a statement on the dashboard. You do declare out on that whether it's over or under budget. And I appreciate that because it does make it easy looking at where we are versus when the grant ends. And I also like that you put on there whether it's a deliverable or a reimbursement grant. That makes it easier for us to follow too. So thank you for calling those out on those grants.
Yep, you bet.
dashboards.
No problem, happy to. Going on to just our regular report, which is for the month of December. The Commissioners, of course, approved a 4% increase in wages that will take effect February 4th. And the Health Department General Fund and the grants will be able to absorb this increase, so we're okay there. In addition, the fiscal year 23 budget cycle started, so I'll be contacting the Finance Committee at some point and keeping everyone updated as that progresses, so. And the General Health Fund, 1.4 million versus $1.5 million a year ago, so just about the same spot. Again, nothing new with immunization clinic, just down from the previous year a little bit. Environmental health doing well. I just feel like I'm repeating myself on that one. Mosquito, of course, like Jake mentioned, that they're looking to purchase a truck and a utility train vehicle. The animal shelter, this mentioned a little earlier, digital system. One thing though, home health, December cash balance is a negative 50,000, along with the AR balance at the time comes to 206,000. So that is down a little bit, about 32,000 versus the previous month. And where we're sitting today, it's down even a little bit further. So something that probably needs to be looked at. And for the new people, maybe we could go through just, maybe page 1 here. Okay, the next one, I think you have it right there. Address maybe some questions. This first budget, this is the General Health Fund only budget. And what it compares is the total budget for fiscal year 22 versus the actual year-to-date expenses. So that just gives you sort of an overall view of where we're at with the General Health Fund. On the next page, page 2, this is the same budget, but only the budget is done year to date. So you have your year-to-date expense or budget versus year-to-date expenses and revenues. And so it gives you a little bit different view as to how we're doing through this time period at the end of December. It's made up of a couple different headings there. You've got the different departments. Those departments are all summed up in that summary of all departments column there. So you can sort of see where we're doing year to date. And of course, this is just a general guideline. We don't actually spend, everything at, if we're halfway through the year, we're exactly 50%. Things sort of ebb and flow a little bit, but it gives you a general idea of how we're doing. So the next page, which is the Health Fund CIP budget. So it just gives you a breakdown of where we're at with our CIP fund. And probably one of the major expenses we've got coming is going to be the AC chiller that had some lead time. I think we talked about that last time a little bit, or maybe the meeting before. We should be getting that in the spring and installed. So it had a pretty long lead time on that. Page 4 is home health. And you can see that at the end of the day, there's negative cash there of 52,000. At the very bottom, cash account receivable, 206,000. So again, down a little bit more of this month. And then of course, the wrap up of the grants there in the those last pages. So are there any questions about the budget in general?
Madam Chair and Kirk, I do have a question on page 2 in the administration contract services. What kind of items do we naturally see in the contract services?
That a good example would be the HDR, I think it's HDR engineering for administrative services. That column there, that would be a good one. Although fortunately, I do know that the
be some other funds that I think that will pay for those. And those are the bios, that was for the biosolids project. So it's those sorts of professional expenses. that we-
Okay, thank you. And one other question on the percent increase in wages, is that for your hourly staff or is that also on contracts?
That would be for all the employees of the health department. So for grants and general fund.
Okay, thank you.
Yes.
Thank you.
You're welcome. You bet.
So, about Spanish planning, I guess if anyone has any questions, they can get a hold of Joe on that.
We have a significant amount of people out.
Well, we want to. Okay.
So Joe, I do have a question on family planning. At one point, the jail had worked with us bringing people over from the jail. And from my understanding, that's not happening. Is that something that we can look at again?
Sure. So there are two things. Some of the folks that do come over here are actually the ones at the health center.
Okay,
We do provide services in the jail. They generally don't come over here to seek healthcare. They usually go there. But we do provide several services, and we can, when they do report next month, we can go.
That would be great. Thank you.
All right, any other questions on this? All right, we're moving into committee reports. There's no committee reports at this time, but Bill, I know you and the septic people met. Is there anything to report there?
Yeah, so, yes. We do have a master services contract that will go to the county commissioners for signature. Thinking it's on the 24th.
Okay.
There'll also be another, and once I get those straightened out, I will send them to the board to see these contracts. What the owner of this is Flathead County, so the commissioners will be signing the contracts. We're hoping to move them through our environmental health committee, just for updates and such, and then we'll do the updates as necessary for the commissioners. So those contracts should be ready to go on the 24th. I asked them to change Board of Health to Board of Commissioners today, so they should be ready.
Okay. Oh, I skipped you. All right, I got ahead of myself. All right, we're gonna go back to the health officer report. Joe.
Yeah, so a few things just to mention, if you haven't noticed, about one in five people, it looks like nationwide have COVID right now. And I don't think we're any different in Flathead County than we're seeing there. So if you look at the new cases, we're seeing a significant amount of new cases per day. We touched 450 one day last week. We're having a lot of trouble keeping up with the situation. So if I have some time today, I'll update those. I'm actually taking all the cases right out of the state's infectious disease database because we can't keep up even though. New cases in December are going up. Prevalence of disease, I think, going down. This is pretty remarkable. This is the active cases. This is 10-day active cases right now. We're over 2,500 active cases, and that's not going down. So just so you have that. Total test positivity rates have gone significantly higher. I just got the email before, we're 35% positivity rates in Flathead County right now. So every 100 that are tested, 35 have COVID. And some of that's being driven by the lack of rapid antigen tests that are available in the community. It's changing what type of testing is being done. We're going to see a reduction in the amount of tests, but conversely, we're going to see a lot higher positivity rates because people that are symptomatic are testing. So you see that breakthrough cases. The Delta was pretty amazing. You know, everyone's saying Delta, the Omicron, we're gonna have a lot higher breakthrough. We haven't had Omicron for more than a month in Flathead County. So we're gonna see a big shift from Delta to Omicron. We'll probably see more breakthrough cases. It's pretty evident that that's what's going on right now, is we're gonna see a lot more breakthroughs with Omicron. It's just the way this new variant acts. Vaccine administration, if you read the paper today, you know that we're gonna see our mass vaccine clinics at the fairgrounds on the 1st, will be our last one. You know, it takes a lot of resources to run those, and we do rent that space, and we can probably shift with the amount of demand that we're seeing back to the health department and operate on Tuesday. So February 1st will be our last mass vaccine clinic at the fairgrounds. Average daily census, just so you see, we've been doing pretty well for a while. It has creeped up. I think yesterday we had about 35 in the hospital. As I said, I'll try to get situation report with hospitalization information updated to you today. I thought the lady that was out here had some really thoughtful discussion around hospitalizations and such like that. If I can do this and protect the data, I'd be glad to do that. You know, we do have a lot of folks that are in the hospital, predominantly unvaccinated still. I will try to give you those rates, but I need to protect that information. It's, you know, if I give you too much like ages and such, then you can start to pick up trends and such, and you might be able to pick up, oh, I know Billy was in the hospital. And I have to protect that data pretty closely. So if I can figure out a way to do it and protect people's rights to privacy, I'll do that.
That's good for knowledge.
Yeah. Just a few things. Our cease and desist order, he actually has a warrant out for his arrest. They're not going to go get him, but if they pick him up on something else, they will. Next month, we'll start the regulations, septic system regulation, and right up your alley on that. So that'll start next month. And the guidance document, just so you have, this guidance document is basically the same document that we had before. Many of you, but remember, there were some significant changes from House Bill 121 and some other things. So those have been incorporated in here. Even though I did put this together in this fashion, if you see something, that just send me an email. I do not have, I didn't have anyone else edit this, so it'll be up to you folks to edit it. But this is just updated, has the interlocal agreement, the new interlocal agreement, the bylaws, the new bylaws, has the administrative rules in Montana around communicable diseases, and appendix. Go through and pull all of the policies the board has adopted over time, so you can see those, and we will bring those and put these in the document. So what you'll probably be asked to do is bring the document so we can slip them in at that point. The last thing that I wanted to mention, and this was something that Pam had asked, this is, there's been a lot of discussion around, and a lot of discussion today, and we all know that there's certain things that we can discuss, but we can't really take action upon. So I wanted to give you some information that relates to some of the discussions that were made today, specifically around me violating House Bill 72. And I think the best way to go through this is, the first thing, you've seen this first document in here, you've seen this. This was something that I provided to the board several months ago, and it basically, when I first started that, I always had this issue is, where are the authorities to do COVID-19 anything? So I went and found the administrative rules, and then I went through the powers and duties of the boards of health and also the health officer. And those are all highlighted about what we're supposed to do. And it's interesting that, you know, boards of health and health officers are actually supposed to protect the public health. And everything is kind of written in that fashion. So if you look at this and it says, the Board of Health is supposed to do epidemiologic tracking and investigation, screening and testing, isolation and quarantine measures, abatement of public health nuisances. These aren't discretionary. If you know what I mean. These are written to protect the public health. So just keep that in mind. The second section, everything I just kind of put in sections. This is one of the policies that I don't even know if the Board of Health has ever seen. I don't know what happened before I assumed the role of health officer again. And Pam, I don't know if you were doing 14 or not.
I was.
So this was a policy adopted by the board around quarantine and isolation procedures for highly pathogenic diseases. This is a board policy that was adopted by the board in 2014. This is one of those things that I am bound to as a policy that was adopted by the board. The next one, I think, is probably the most pertinent to the discussions around what was mentioned today. And this was the state of Montana's Department of Public Health and Human Resources put this document out in
We have too many in the audience.
and I have one extra. I will need those back because those still have the two county commissioners that were present too. So as you're probably aware, House Bill 702 created a lot of chaos before this last school season our school session started. And on the 1st of September, the state health department issued this guidance to local health departments. Now, there's an email that's attached to the back of it, just so you know who wrote this. This came from the directors in the governor's office. So this has basically been vetted through the state of Montana, and this was sent to us. And if you, and I want you to read the whole thing, but I'm just going to go through and tell you. At the end, there's 3 bulleted items. At the end of page 1 and into the page 2, it states strongly recommending but not ordering quarantine of unvaccinated close contacts individuals and isolation of unvaccinated infected individuals. This was the guidance that was given to us, local health departments. If you look at the last 2 sections, you will see that there is no mandates. Things are advised and recommended. And that was what the state health department asked us to do. So if you look at the last 2 sections and look at the 3rd to the last section, you'll see that this is the state, this is the governor and the director's office guidance that we were supposed to follow. If you go and look, my documents parallel those documents that were sent by DPHHS. Pam and I have had multiple conversations around this. I continue to tell Pam, I'm just following the state's guidance. I will actually have Janelle scan this and put it out on our website, so anyone who wants it can look at this. This is the criteria that I use to do my job. And I can tell you there were some pretty lively conversations around this whole issue, but at the end of the day, we followed the school board's attorney and also the state health department's guidance. And you'll see that the letters that I wrote and the quarantine letters that we use advise. And the interesting thing is that my last comment, we started the year, the second to the last section, because 12 to 18-year-olds were afforded vaccination. We started the year with 12 to 18-year-olds advising. Not one person said that we were violating. And my letter to the schools and our quarantine letter is in here. Not one person said one word that we were violating House Bill 702 before the school school year started. And all I did was parallel 5 to 11-year-olds starting basically the end of December to comply with the same letter that we were doing for 12 to 18 the whole year. Not one person ever said we were doing something wrong. And that letter was in.
As you say, we have talked about this a lot through the last, long we've been having to come back. We've talked about a lot of things. But basically, we want to make sure that we're following the law. I can say that through the whole COVID, even before you got here, the health board fought mandates, masking, all of that. And we stood strong on that. There was some close votes. But at the end of the day, the health board never passed mandates, never passed masking ordinances, never forced anyone to do anything they didn't need to do. Or didn't want to do. It's liberty for all, right? Everybody can mask up or not. Everybody can get the vaccination or not. And through the changes on the board, I've had several conversations with new board members, and this should be a personal choice. This is something that we don't need to stick in people's faces and say, you have to do this. And we have not done that. So I'm very proud of the health board and what it has done. And I think even the new members understood that, because even as we got new board members, they never brought forward any mandates either, because they knew that our community had made up their mind about COVID. There was no, everybody was going to do whatever they were going to do. And there was nothing we were going to do to change that. And besides, it was their right to do whatever they wanted to do. From the health board side, which also spills over onto the commissioner side, and I can say we kept things open. And when Governor Bullock came down on the commissioners and said, you will force masks in all businesses, or you will shut down businesses, we said, heck no, we're not doing that. So what did he do? He sent his people to Flathead County. They went out and they went into these businesses. They picked like 4 or 5 businesses. I don't remember how many there were. And went in and shut them down and filed lawsuits against them. We stood strong with those businesses and they won in court. So at the end of the day, I get that this is a highly, it's just, everybody's been through a lot in the last 2 years. And I get the passion, I get the, but at the end of the day, I think the board has remained diverse. And I like that. I like a diverse board. We have both sides of the table here. And we have a lot of good discussion. And I think it's good that we have a good discussion. Are we all going to agree? Absolutely not. We're all going to agree. We're just going to make up our own minds what we do. So whether I agree with a board member or not, I respect each and every one of you. And I think you all have a right to your opinion. I think you all have expressed that opinion. I think it's went out to the media because our board, our board meetings are out in the paper, whatever we do. So it's a little unfortunate that now all of a sudden we're being told that we're forcing everybody to do something, when we have never done that, and we don't plan on doing that as far as I know, and I will fight it if we do that. But Joe is the health officer. He has to do what the rules tell him, what the EPHHS Montana governor puts out. I mean, I guess the only thing I would maybe suggest is when we do these letters to the schools or whatever, we just reinforce or put a little something at the end that says, these are suggestions. You know, even though it says it in the body of the letter, that it's a suggestion, maybe we just add that, just so that it's very clear that this is out there, this is all the information, but this is coming from the health department as a suggestion, and this is what the CDC is suggesting and whatever. I just don't know. I think maybe that would be a good thing, because people are upset with our government. I don't blame them. I'm a little upset with our government, but you know, at the end of the day, I think in Flathead County, we've done a really good job. The other thing, I'm sorry. One other thing, there was one other thing that was brought up, and informed consent. Joe, I've talked to you about that, and you sent me the paperwork that's been put out. I also asked you to possibly put something that the parents or whoever's getting the vaccine has to sign that says that they got the information. Was that implemented? Okay, we need to implement that. I think I asked for that a while back, so please do that. Because people, they need to know that this is it, these are the websites you can go on, please sign here that you know what you're doing. And I think that's important that we have them sign that they received the information that they should be receiving. So, yeah, so informed consent. I think that's all I have right now, but I reserve that I may come back. Okay, so anyway, anyone else?
Can I comment on what you said?
Sure.
And then I have some comments for Joe as well. You know, one correction, and I have the minutes printed out in a physical copy of March 19th, 2020, our meeting at that time.
Okay.
And we had a meeting on the phone the Monday prior, was like an emergency meeting, and we voted against Hillary Hansen, who was the health officer at the time. We voted against her at the phone meeting to shut down the restaurants, wineries. We voted against it on the phone. And then and then 3 days later, or the next Thursday when we voted, she promoted that. We found out in those 2 to 3 days that the health officer at that time was able to do all these things without our vote. We could all vote against her and she could still do whatever she wants to do. That's when we found out. That was
the law, yeah.
That was one of the things that the legislators have corrected last year. Right. Okay. So when it came down to it, and it was a mandate that the restaurants and I think it was bars and wineries it was a mandate that they could not have indoor seating. I was the only one at the meeting that voted against it. So it is not true. So it is not true that this board has never supported mandates.
Huh?
That was the governor.
That was the governor.
But what I'm saying is we had the option at that time. We voted on it. So.
And we voted not to, but the governor did it.
No, we voted, I was the only one that voted against it. You and Rona Lee led the charge, voted to support the health officer. It's in the minutes. I'm sorry.
Well, I have to look it up because I don't remember.
So
I'll
I do
send it to you.
remember the motion, and yes, we made the motion that we were going to support the health officer as we were, in March, we were going off of everything that had to do with the governor's mandates. She was just saying, if we do the governor's mandate, will you support me in the public? March, we still had news reports telling us that everybody's dying in the streets.
That was early on.
In that same minutes, it says right at the top, 0 cases in the Flathead, 12 cases in all of Montana.
All we supported was the health officer doing what the health officer was implementing based on the governor's mandates and supporting the health officer as we worked with the health officer. And that's when we came back with.
So to heck with keeping our oath to the Constitution to protect the liberties of people. I mean, basically, and that goes back to a couple of things that I'm going to say to Joe. So my point is, it's not true that we never voted for mandates. I was the only one that voted against it that day, and I have the minutes to show it. So it's simply not true.
Yeah.
And approximately a year ago, maybe 10 months ago, I had asked for what you just asked in those letters to the teachers, to the superintendents, to the parents, to say that it's just a suggestion. And I had asked on this board that we could at least go neutral. If Joe's gonna do his thing, we should at least as a board go neutral, because when he is out there writing these letters and we don't even know about it, And I'm not finding out about it from Joe, I'm finding out about it from parents and teachers, all right? There's something wrong with that, and I brought it up. And so we need to take, take it as an action item if we're gonna, and I couldn't get anybody, including all conservatives on this board, to support me on that. I couldn't get anybody. So it is not true that this board has supported liberty. It is not true that this board has never supported mandates. So I just wanted to clarify that. The other, so as far as the suggestion that you put something in the letter that says this is just a suggestion to do these things, I asked for that probably 10 months ago, a year ago. So why that didn't happen, I don't know. Okay, so now any questions for Joe, or should we wait?
May I just say something a minute? I don't have time to do a rebuttal. I actually need to leave a couple minutes early. So I just wanted to say that I'm signing off. I don't really have time to get comments today because of the rescheduling. So
Okay.
I'm signing off. So I'm signing off today.
Okay, thanks, Pete.
Thanks, Pete.
Yeah.
Okay, Andy.
So it's the question you brought up that you're just following, what the DHS says. So, and you also just follow, and usually you just, I don't know, you just take what the CDC guidelines are and you just put them out there. You just, we call it, I don't know, regurgitate it, whatever. So, but Montana law says you're not supposed to. And these here, with this handout that you gave me, those are just general guidelines. I mean, it doesn't say that whatever the health officer wants to do for isolation and quarantine measures, if what the health officer is doing doesn't make sense, in terms of quarantining healthy children and those kinds of things, doing massive contact tracing, this doesn't say that he could do isolation and quarantine measures no matter what. It's just saying that that's part of his responsibility. So this does not by any stretch of the imagination overturn Montana Code Annotated that says that you're supposed to do it under our guidance. And we don't even get the letters that we don't even know. I find out from citizens. I find out 2 days before a meeting. So, it's inappropriate. So that's one thing I wanted to say. So when the CDC and state guidance goes against Montana law, I would say from a legal standpoint, the law should prevail. And I'd recommend we get a legal opinion on this. Okay, so other things I wanted to say. This was before you came on as health officer. I believe it was Tamalee. I asked her to define active cases. An active case is just somebody that's quarantined or isolated. It does not mean they're sick. And I think that's very important. And a case just means a COVID positive test. So when you're doing contact tracing, you're building the active cases because you're quarantining healthy children. It does not mean they're sick. So I'm wondering, has the definition changed? Has the definition changed?
True.
Okay.
This is not the first time I've said this. You isolate sick, you quarantine exposed.
Correct.
We don't add quarantine to the active cases. We don't.
Okay.
We don't.
Tamalee said you did, but that's
Generally don't work here.
okay. Well, good. I'm glad to hear that. All right. So another thing I wanted to say about testing, I have there's an excellent, CDC website. It's called COVID USA. And then you could do COVID USA Montana, COVID USA USA. And you can look at the numbers and it's really easy to compare. And in March, it was around March 1st of 2021, in the United States and in Montana, so presumably in other states as well, the number of tests that were done exceeded the people in the population. Okay, you can see it yourself. There's like 103% of the population in Montana. There have been that many tests. And obviously it's because there are people that get tested every week for their work or whatever, but the number of tests done exceeded the population of Montana. The number of tests done in the United States exceeded the population of the United States, okay? And then what they did, what was so interesting, so it was a great website, they stopped listing the number of tests done. They stopped. It would no longer show that. They showed that increased number of cases. We had no reference point. And when they stopped, they were checking in Montana 3,000 to 4,000 people a day. And I remember at times they were checking 5,000 to 6,000 people a day. So anytime you do that with a test that's woefully inaccurate, like it especially was in 2020, you're going to get a lot of false positives. You're going to get a lot of meaningful data. And those cases are what are driving you to do this contact tracing and quarantine exposed healthy kids. So I think that needs to be looked at. I think it was Teresa Farr that talked about looking at, making the data meaningful. And in terms of having to protect, patients' privacy, by having somebody analyze the number of comorbidities, they don't have to even say how many or what they are specifically, so nobody would really be able to tell. So that's not gonna violate HIPAA, and I think it would provide much more meaningful data if we could look at that. And the other thing is, I know for two of my patients that tested COVID positive, these were the two that of my 13 or so patients that I sent to the hospital that were COVID positive, the two sickest on presentation were both fully vaccinated, and in their H&Ps and in their discharge summaries, neither of them mentioned their vaccination status. So one of them was in the hospital here, one of them in another town. So, people's, concerns that the data is not being, entered accurately, I know is justified, because I have the H&Ps in front of me. I can see, it's like, oh my God, this woman with a portal-vein thrombosis and going into her splenic veins and in her mesenteric veins, and she might die. She had the booster 3 weeks earlier. And it's not even, that is not even mentioned. So we are definitely getting skewed data. And somebody mentioned the Israel study. And in the Israel study, this is as of September, I don't have the updated data, but in Israel, they massively vaccinated their people. And it was in the population, like 74% of the population was vaccinated. And of the people that qualified for the vaccination, it was about 85%. And of the patients, this is as of September, of the patients that were sick enough with COVID to be hospitalized, 88% were fully vaccinated. So our numbers don't match up with the Israel numbers, which are probably the best data that we have. Gibraltar has really good data too, because they're over 100% vaccinated, because people travel there and have to get vaccinated. And their data is the same. And so why is ours different? Why is ours different than that Massachusetts, that CDC study out of Massachusetts, where 74% of the people that tested positive were fully vaccinated? Why are our numbers, why is it a disease to be unvaccinated? It doesn't fit with my small patient population. It doesn't mesh with the Israel data. It doesn't mesh with the CDC Massachusetts data. So I suspect the data is not being collected correctly. And I have two cases that, people that I know and have seen their H&P and discharged, to know that it was not mentioned. Now, whether they entered it somehow in their data system that this person was fully vaccinated or just boosted, I have no way of knowing. But if it's not in the H&P and it's not in the discharge dictation, what reason would I have to think that they actually accurately entered that? So it's a serious problem. So, and in terms of the duty to protect public health, the suicide notes that I know from young people, that they've been made public during the 2 years, during the COVID debacle, it was because of isolation, not being able to be with their friends, having to learn from home, abuse issues in the home, those kinds of things. So when you talk about protecting public health and the elderly people that are locked up in those nursing homes, what about those elderly people? What about these kids that are left in isolation? What about the incredible rancor in our community, the absolute hatred? And that's not because of people that want choice. It's because of people that want things to make sense. And they don't want to be forced to do things. They don't want to be bullied. So you have to look at the public health as a whole. You can't just look at one thing, vaccinate and contact trace, and somehow we're addressing public health by doing those things and doing everything the CDC says. And I, having been a doctor for over 30 years, I have seen, through that history of, doctors are becoming really robotic technicians. The critical thinking is progressively over the decades, less and less. And so they'll just do whatever the CDC says, or most of them work for a big corporation like a hospital. They're going to do what their CEO says. And that's what I've seen. And it's not in the best interest of people's health, public and individual, to do that. So again, back to this. These are just general guidelines, and it does not say, even if what the health officer is doing doesn't make sense. I think the board needs to be involved in that. That's it.
Well, first of all, some of those are statutes, some of those are administrative rules, and they need to be abided by. But Andy, I think you really need to be careful characterizing most of the medical profession as robotic I'm sure that they would take offense to a statement like that.
I said it to them, so
Well, good.
it's a general trend. I'm pretty.
So, a couple other things. Our data does not support 76% vaccinated people are hospitalized. It just doesn't support it. I do see vaccination status in the hospital record. I don't know if that's 1, 2, fully boosted. It doesn't go into that detail. So I can't qualify that. It's not my data. If it's my data, I'll control it to the extent I can. And our line lists have when they have the vaccination, first vaccination, when they have their second vaccination, and if they were boosted. So my data is good. And it's coming right from either the infectious disease system of the state of Montana, which all labs are reported to, or it's coming out of the immunization tracker, which all immunizations are tracked to. Now, Andy, I will tell you, we are so far behind with the amount of cases that we have. I am not going to give any qualification on when I can catch up. But I will tell you, I mean, when we're seeing 400 or 500 cases a day, we don't have the staff to keep up. But when my data is controllable, 40, 50 cases a day, I can tell you the exact dates that everyone had their vaccination. So our data is good. I wouldn't report bad data. It's not, the epidemiologist in me would not report bad data. So I'm going to report the data that we have. You brought up several times, but you can't get this board to take up a motion or an agenda item for a full discussion. And I will tell you that this is a problem with this board. I am sorry to state, we don't have a board that can have a rational discussion around some of this information. Some board members will take one side, some boards will take the other side, and we will get nothing done. Now, I'm not saying that that's why I take it upon myself. What I brought to you, whether you think it's arbitrary, capricious, my words, is how I have to work. Now, I'm a health officer, did it for 30 years before I retired, and I came back to protect the public health in Flathead County. The other thing is the characterization that people are suicidal, and we have had suicides based on the actions of public health. Dead wrong. We have, when I came back, our schools were opening. Our masks, there were a few people, there were some that were enforcing mask mandates and some that weren't. But I can tell you, the isolation happened when people couldn't leave their homes. I have worked with superintendents to keep these schools open because I understand how important it is. Isolation is a terrible thing. People not being able to go to work is a terrible thing. And you have never heard me as the health officer say anything more than this community is healthier when people are at work. And that's what I've been trying to do. Why do you quarantine exposed people? So you don't have 30 of them running around with COVID. You isolate, get them out. You quarantine them so not everyone is going to have COVID in the classroom. That's what closes schools. So we collectively, the superintendents and the health officer, have worked to keep these schools open. And I have never changed since I started in December of 2020. I've told you, I'm going to keep the schools open. We're going to do what we can to keep them open. And part of that is doing isolation and quarantine. Because if you remove people that are exposed and they don't get sick in the school, they don't make other people sick. This is the same thing I've been doing since day one. And we continue to evolve. I would guess, health officer, thinking of all the stuff that goes on, and we probably won't do quarantine in 2 months. It's going to go away. I mean, I can tell you from what I've seen, we won't quarantine exposed. But right now, the policies that come from the state health department and the CDC, and I guess I'm one of those robotic CDC people, still say you need to quarantine. And if you want to bring to the board a discussion around relinquishing isolation and quarantine measures, have at it. Go ahead. I'll follow your policies, but the only policy I have now is what I gave to you.
Okay, so a couple more things. As far as keeping the schools open, the primary way that it was thought to keep the schools open was by massively vascular children and doing a lot of contact tracing. I mean, that is, I think, even during your time here. So that was the idea. Yes, keep the schools open. We've got to do this. So we mask everybody and quarantine and isolate and those kind of things. Now, if you look at like the community health, they showed 0 influenza hospitalizations. And one of the people here, I think it was Teresa Farr, brought that up. I mean, it's a bit suspicious, all right? Now, most of the people, this Omicron, it could be just another coronavirus. I mean, prior to the COVID debacle, when somebody was sick enough to go to the hospital with a respiratory illness, then there would be a viral panel that they could do that had 5, 6, maybe 7 coronaviruses. So they've been around a long time. That term was coined in 1962. So we have had those on our viral. So why is it that all of a sudden Omicron is something different? It's like people are getting sore throats and colds.
And
In the cold,
it's not on the respiratory panel.
in the
The
no.
common cold coronavirus is not on the respiratory.
But my point is there were 5, 6, or 7 coronaviruses on that panel
Four.
prior to COVID.
There are 4 common coronaviruses in general circulation. There are 3 that came up. First SARS, MERS, SARS-CoV-2. There's 7 circulating coronavirus in the world right now that infect humans. 4 cause the common cold, which we haven't been able to vaccinate for, because you know how hard it is to vaccinate for stuff like that. And it's not in the respiratory panel. It's not. SARS-CoV-2 is in the respiratory panel.
That's correct.
Okay, in the interest of time, we just got this, so we've got some homework to do. I don't think anybody's seen it yet. I think this has been a good discussion. I think at the end of the day, some of us are just gonna have to agree to disagree on some things, but at the end of the day, I still say that we did not pass any mask mandates through this board that I'm aware of that didn't come from the governor or somebody else. And we worked hard to keep the county open, keep the fair going, keep all the other stuff going, courthouse open, and I'm gonna leave it at that. So unless somebody else has a question on this, yes.
The antigen tests, do we have those at the health department still, or how are people getting those? I know they're at Walgreens and they're at Apothecary, but do you know kind of the timeline for people that do want to have at home antigen tests when they're gonna be available? Okay.
Talk about frustration.
Okay.
When our president decided he was going to give them out, our distribution went to 0. We had had nothing since that, and we don't even know when we're going to get them. And I think it's a travesty what happened at the federal level, because it's destroyed a really good system we had going. And even the schools are going to run out of rapid antigen test problems there.
And then I said one more point. So if people are concerned that positive cases are going up because the number of tests are going up, there's just the test positivity rate. This is just simple. Take a positive test by the total number of tests, and that gives you a good kind of metric. So you can look out over time what the actual positivity rate is, no matter how many tests have been administered. So that seems like conversation keep happening over again, but it's just simple division and a percentage. So that's a good thing to look at if you're interested in a metric to follow over time.
Okay, anyone else have any thoughts?
Yes, Madam Chair. I guess the first one is because again, public comment is pretty adamant and heated with this. And we're talking about semantics, guidance, and Joe, I understand you're doing your best effort to follow the guidance. And I read the letter again, it's guidance.
But we have an obligation, I think, to go beyond guidance. You know, I think our community is asking us to go beyond guidance. And so I don't know John Ebelt. I don't know what his status is as a public information officer. That is something I would like to know. I would like to know if that was vetted by the Attorney General, you know? And I'm not asking for an Attorney General's opinion on this, but I am asking for a legal standing on, does this person have the authority to make guidance,
Well, it came from-
recommendations based that seem to run contrary to the actual bill he's giving guidance on? And that's why I think with what I'm hearing from the community, I've read all the emails, including the ones that came through at noon today. And it's that legal issue, you know, and I think if we could get some interpretation of that from somebody who's in the legal field,
Well, it does
it would
say
make me feel better.
in the email that it came, that the DPHA's director and legal affairs office of the governor. So that it has been run by the governor's
Some
legal,
legal affairs.
you know, maybe we could run it through ours, but
Run it through and
yeah,
ask the
yeah.
question. Let's do due diligence
Yeah.
for the community's sake
Sure.
and just ask the question.
Sure.
And, you know, I know that they didn't write the legislation, so
Sure, well, that's true.
that's
Yeah.
that. And then I do have one question, Joe. I was recently looking for antibody tests, which you were able to get quite some time back, and can't find them anywhere. Smith's used to do them, and then someone else would do them, and it went from $25 to $100, and now I can't find an antibody test anywhere. For the community members who want to check their own, not just if they've got COVID, if they've been exposed, they want to check their antibodies and see if their vaccine is working, if their booster is working, if their natural immunity is working. I'm curious, and I just, in your capacity, have you seen, or can you tell me what's happened to those?
What I mentioned, I used to be a real antibody guy. I thought, oh, this is great. They're not reliable tests for the expense, and they just, many of them, many organizations have stopped providing them. They're not an accurate test. I can send you some literature on why they kind of moved away from them, but at one time I thought we should go around the community, do an antibody test, get enough power to understand, you know, how many people really actually had COVID. But it's not a reliable test.
I would be interested in that.
I can send you some stuff.
Thanks.
Yes, ma'am.
So thank you for putting the packet together and looking at the packet and policy 2014-01. We are not in, this policy is not in compliance with contact code annotated. So we will need to put this on our agenda to address this policy. So I just wanted to bring that up.
Sure. And if anybody sees anything else, certainly bring it up and let Joe know as you look through the packet.
Madam Chair,
Yes.
I just had this a comment.
Yes.
I don't have the expertise that many of you do in the medical field. But what I do have, I have a lot of experience dealing with people and people coming to meetings and listening, taking what I can out of it and addressing it. One thing I thought that came to mind, and these people are they're fired up. That is wonderful that they care.
Right.
What I did find, there's a common thread to it that I noticed, and that is we want to make up our own minds. We don't want to be forced. And yet we say we're not forcing anybody. So where does that come to us for? Why? We're not forcing anyone. If the federal government is forcing, I don't think I've seen that either. Now, if you say you can't go in a store because that store has determined that you need to wear a mask, they can tell you not to come to their store because they don't like you. It's their store. So I just, after you hear the same thing so many times, you start seeing this. Many of the things that were quoted today, heck, I don't know if that's true. I have no clue if all those things those folks have done. The numbers they were throwing out, 77% of the people dying are because they have gotten the shot. I don't know when that's true, but I'll listen to it. But what I didn't see is where that comes into this board's purview that much. We're not mandating anybody. One other thing, and that is, why don't we have a member of the press
Well, they're probably on one.
should know this, and it should be reported of what this group talks about, what the folks have brought forward. And it shouldn't be the little article on the bottom that says, this is how many people are sick. It should put what this board as a group is trying to work towards community health. I think that's just super important. So that's my thing. And please forgive me if like I said, I'm not a doctor. I'm not trained. I'm just, but I've worked with people for many, many years in my role in government and in volunteer organizations. So that's all I have. And I appreciate all you guys' time and coming and doing this. It's a wonderful deal to see this many bright people get together and share their ideas. So, okay.
All right, so I think that's it for the discussion, I believe, on this. I think that's what we're gonna go around in a minute and do the last item, which is board member comments, which I hopefully will, in the interest of time, won't be too long because some of us have to get home. So yeah, board member discussion, we'll start with Ann.
Oh my goodness, I think I've said everything I want to say.
You
I
said
guess maybe I'll just address yours then really briefly, and that is that one of the things that we've talked about over the last year at least is that when our health officer sends out a letter to the schools, for instance, about masking, and he makes a strong statement, and we didn't even know about it, but he made a strong statement about it, or he's making a statement about quarantine and isolating. When these superintendents and these school boards, and these teachers get this, it's like the force of law. It might not be in a mandate officially, and maybe that's how they get away with it, but it carries a huge amount of weight to these people when they hear the health officer. Now, if we had taken a vote and they knew that we were in agreement with them or something, maybe that would make a difference, or if he put in suggestion, but his letters are always very strong, and it carries a lot of weight. So that's I think why this is still extremely important to people. And also the business of the FDA, not following that. We've been doing vaccinations here in the Valley for a year now, and we haven't been following the FDA recommendations for informed consent. That's not a, oh shucks, that's a big deal. And so that's why people are upset. And just like I'm seeing people with serious complications from the shots, so are members of the public. So that's the reason it still is in our purview. I think that's all I have to say.
I have no comment.
Okay, Rod.
Well, I'll wait. As far as the committee appointments.
Yes.
You had made mention that you thought it might even be time, especially based on this, to maybe just get rid of the COVID-19 committee altogether.
Basically because we have so many good things that we're doing in our community, not because of anyone in particular, just because we all need to kind of move on from COVID. I think COVID has run its course and it's time to move on. But since then, you have shared with me some of your ideas for that committee. So I'll let you continue.
Well, I think it's important because military background, we always did after action reports. We can learn from this. So as far as how we communicate with the community, how we communicate with schools, maybe the board should do a press release, because I can tell you the sound bites that will be in the paper tomorrow won't have anything to do with the good that came out of this. Maybe that's something to consider down the road, but I just think it's important to be continually looking at how we got here as a community, as a board, as a, how it's affected everyone, and what we can do to move beyond it. Not necessarily to keep, I love your reports and all the numbers and all the, because I'm a stat guy too. I like looking at those things. But you know what? I'm ready to look at it in the rearview mirror now. So I understand your point, but I think we're ready to look at how do we move beyond instead of how do we look at it. We're in it. Let's look beyond it. So I think that we can do that.
Looking for your report next time.
Well,
I think it'll be good.
I haven't
Have an
talked to
after-action.
Jessica or Dr. Reed yet, so that's my opinion. So, They can disagree.
Well, you guys
Maybe we'll
can- you
disband
guys-
after the first meeting.
Right, you guys can discuss that. So,
Okay.
be very helpful.
That's all. Thank you.
Raleigh.
I did want to ask a question, follow up from public comments that came from, I think it was Jake, who said that he was under the impression that public comments were going to be closed. You could only provide in-person public comments if you sign up ahead of time. So I did want to get clarification as a follow-up on that, that we have public comments.
We allowed everyone today to comment that wanted to, is that correct? Is our policy before to
It has been, and so it's right above call to order. To register to submit public comment, please click here, submit by 11 a.m. on the board date. So if you don't like that comment, it would be easy to resolve it.
Well, I thought it was important for everybody to get to speak today, so I guess I kind of went out of my purview, but I think we need to, what does the board want? I think public comment is important, although, we're at that about an hour or so, which is public comment,
So I didn't know if the registering to submit public comment prior to this time was as a result of going to Zoom meetings, and that it wasn't anything that we were doing prior to Zoom meetings, and that,
No, that's what.
It was a result of the.
and so now that we have in-person meetings, I just want to, again, follow up for point of clarification, that if somebody shows up, they will be able to give public comments.
I would like to see that, but what was the board?
Yes,
Yeah, I think it's important.
Okay, thank you. I just wanted to follow up on that public comment. Another is on the committees. I would like to request for the Finance and Budget Committee to meet with the Home Health Committee, and the two chairs can work with Joe and with Kirk, because I think that we need to look at the numbers that are coming out of the Home Health Committee and talk about that as it relates to the overall health and finance budget that we have for that. So if it's okay, I would like to work with Joe and Kirk with those two committees to get a committee meeting so we can have that.
Would that constitute a quorum? You'll have to figure that out. Yeah. Okay.
Okay. And then my final is a point of order. I do not believe that I've ever violated my oath or have ever violated anything to do with the Constitution. I want that on public record because, you have attacked me as a person. And in doing so, I have received text messages calling me I love this one, Marxist revolutionary, socialist, communist, along with text messages saying they're going to follow me home and remove me from the community. So when we make inflammatory accusations in this meeting as public record, there are consequences. So my point of order is to say that I take exception to being called something publicly that I am not.
Jessica.
One thing I did think of is that Logan Health does a really great Instagram post every week about the number of cases that they have, how to present which are vaccinated and unvaccinated, how many are in the ICU, and how many are in ventilators. So really interesting information is available weekly. And then the last thing was, I just really appreciate our health department. I know there are certain things that come up that really are, divisive to our community, but in general, they get, they're out there every day working really hard with every member of our community. And I think we need to support them. They're going through a really hard time. We've had a lot of attrition, and luckily Joe came back and stepped into this position, which is not always pleasant, as we can see today. And I just really appreciate him and what he's doing for the community that I was raised in.
Well, I'll just close by saying, I think it probably is, I'm glad they came today and visited with us. I think it's good to have these discussions, and I think it's unfortunate again that some of the information out there is not actually what's going on, and that we as a health board have worked really hard to keep our community open. So Anyway, with that, I guess we are adjourned. Does that take a motion here?
Slam.